kleine Auszeit.
Greetings and welcome to the Ayurveda Report. I am Kailas. Today on the show we have Dr. Mark Vinick. Dr. Vinick is a holistic chiropractor with 20 years of experience in practicing Ayurveda. Dr. Vinick sees patients with chronic conditions. He's an expert in that. And one of the things he brings out in this interview is the amazing preventive medicinal quality that Ayurveda has, which distinguishes it from allopathic medicine, for example. Ayurveda, as Dr. Vinick says, is not a passive medicine. It's not a passive process. So it really takes our involvement in the process to make it work.
In Ayurvedic medicine, we find that most conditions arise out of errors, either knowingly or unknowingly, in diet and lifestyle. And so in Ayurveda, we look very closely at diet and lifestyle. We look at what created that condition, what created that imbalance. Long before a condition is diagnosed, there are subtle imbalances that arise due to the errors in diet and lifestyle. Once we determine what caused these imbalances, we can make subtle changes. Oftentimes a few changes in diet and lifestyle can produce a profound effect in the overall course of an individual's life. We can prevent many of these chronic conditions, chronic pain, fibromyalgia, the whole host of autoimmune diseases can be prevented if the imbalance can be determined in its early stages and then reversed so that the psychophysiology returns to its normal state of functioning. I'm licensed as a chiropractor, but I specialize in Ayurveda for probably 20 years in addition to my chiropractic practice. And I can honestly say that those individuals that come and are able to follow the simple dietary and lifestyle recommendations improve. Now, that's not to say that everyone is going to recover. That isn't the case. It depends upon so many factors, how advanced their condition is, and also the knowledge of the practitioner, their ability to correctly diagnose the problem and give the specific correct recommendations. But a lot of it falls on the patient because it's the patient. This is an active therapy. It's not a passive therapy. Chiropractic is a passive therapy. The person comes in, they get adjusted. Acupuncture is a passive therapy. Massage therapy, these are passive therapies. Ayurveda has some passive therapies, but primarily it involves activity and participation from the patient. It depends upon the ability of the person to follow through with those recommendations. In my 20 years of clinical experience, of those patients that have more or less pretty well followed through with the recommendations, I've seen improvement. Stress is due to non-harmonious lifestyle factors in addition to the physiology being stressed by bad food. See, originally in ancient India, it was given that everyone ate organic and everyone ate freshly prepared food. No pesticides, insecticides. It was not frozen. There were no genetically modified organisms. And so one rule in Ayurveda that sometimes people don't emphasize enough is the food needs to be fresh, freshly prepared, organic as much as possible. It needs to have, in Sanskrit there's a term chaitana, which means nature's intelligence, that intelligence in nature that nurtures us from a deep level. That's important. In India, up until fairly recently, right from young age, children were consuming herbs and spices that cleared the liver. They healed the liver. They cleared the channels in the body. They boosted immunity. So those individuals, when they took herbs, the liver was able to properly assimilate them and they could do their function. In the West, unfortunately, right from the beginning, we're given foods that overtax the liver, strain the liver, block the shrotas, block the flow of prana in the channels of the body. And so when we take in herbs, the liver, which is already overburdened, is more burdened by having to assimilate these herbs. So that's why it's important to focus on diet, lifestyle with a smaller amount of herbs and spices, at least to begin with, to allow our physiologies to begin to normalize to gain the benefit of those substances. Let's look at the property, especially of garlic. It's heating. So Ayurveda, we treat conditions and doshic imbalances with opposite qualities. So when it's cold and rainy, garlic can help offset those qualities. So in the early spring and the winter, for some individuals, it can help offset that. Garlic has some useful properties. It thins the blood, it reduces cholesterol, it has a little bit of an anti-hypertensive effect. It can reduce blood pressure a little bit. And it can build ojas. It can build immunity. The challenge with garlic is that there are three gunas, or qualities of nature, that all food has some mixture of these qualities: sattva, rajas, and tamas. Garlic is considered rajasic. It's highly agitating to the mind. So who would benefit from having a very strong, healthy body and a very sharp, active, agitated mind? The military. And the traditions in yoga that recommend lots of onions and garlic, that's their tradition. Whereas more of the knowledge path, the Brahmin tradition, they recommend against it because it agitates the mind. It actually interferes and prevents the mind from settling down into the deeper states of samadhi during meditation. So it's contraindicated for those individuals that are devoted towards attaining higher states of consciousness. In general, I recommend patients not to use onions and garlic, but there are exceptions. I have patients that just love it. And if they're in a field, like if they're an attorney or a really active person, business person, where they're out in the world and they need a little aggression and a strong physiology, in the winter, I say go ahead and have some, but in all cases, I recommend against it in the summer because it's going to create an imbalance. So it's true in general in Ayurveda that any substance, should someone use it or not use it, the answer is it depends. It depends on who the individual is, what their body type is, what their imbalance is, what their function in society is, what their dharma is, what do they do. People for centuries have thought, well, if I really want to make spiritual progress, I need to leave the world, move to an ashram, and be celibate. And let's look a little closer at that word, brahmacharya. Brahman is the totality of all there is. Brahma is the creator. Acharya means a teacher or following the teaching. So the term brahmacharya means either following the teachings of the creator, or it means following spiritual practices. Now, there are genuinely two distinct paths in life. One is what almost all of us are, and that's householders. Those are people that engage in the world. We have relationships, we have families, we produce children. The other path is of the renunciate, who may be active in the world but is celibate. And so brahmacharya for the monk or the recluse is his lifestyle recommendations are no sex, not even the thought of sex. But for those of us that are householders, procreation is necessary to continue the species. So it's necessary. But it's recommended that sex be part of a committed long-term relationship. There also is the idea of a specific amount. So when you're younger and when it's colder out, sex can be more frequent before it depletes the ojas, the immunity. In the summer, it should be, because it's already hot and sex increases the internal heat of the body, it should be less frequent in the evening, not in the middle of the afternoon. And as we age also, the frequency should decrease. And so over time, the knowledge of the householder path became lost. And so people thought, well, if I want to develop spiritually, I need to renounce everything. But that's only because that specific knowledge was lost.
For a householder, wouldn't it be an issue more of cultivating sexual energy for healing? You mentioned immunity.
In Ayurveda, we have 7 tissues, and each tissue, a small portion of it, results in the creation of the next tissue. So the last tissue is a reproductive essence, shukra, and the small portion of it, the shukshma portion, produces ojas. And ojas is our immunity. There's circulating ojas. There's the 8 drops of ojas within the heart that holds the soul there. The circulating ojas are hormones and neurotransmitters, and they boost immunity and overall functioning of the body. So it takes about 5 days to produce each of those tissues in a succession. So ojas is typically produced in 35 days. So if you go for 35 days without losing that reproductive essence, you're going to make more ojas. But there are foods that produce ojas in 24 hours. Sweet, juicy fruits. Good, pure quality, organic grass-fed dairy. Pure, good quality ghee. These produce ojas in 24 hours. So if someone is consuming them, then that also boosts immunity and builds our ojas.
For more content on Ayurveda, healing, yoga, and Vedanta, follow Kailas. If you need an Ayurvedic consultation, I am available internationally over Skype and Google+, and you can get more information about how to get an Ayurvedic consultation by clicking here. And if you're in Los Angeles, schedule an appointment. And remember, I'm available for workshops, presentations, and consultations in your city. I look forward to hearing from you, and I welcome you to my practice, so take these blessings for your journey. Ashirvad. Namaste.